One in 3 Americans suffer from hypertension, a significant health problem that can lead to cardiovascular disease, heart failure, stroke, diabetes, and other life-threatening problems. Researchers at the University of Michigan Health System have determined that the very air we breathe can be an invisible catalyst to cardiovascular disease.
What we are investigating is the confluence of two very important public health issues, both high blood pressure or hypertension and fine particle air pollution, and their interface of how the two of them can conspire to increase your risk for premature mortality and death. Air pollution is a mixture of gases as well as fine particles which are around the 1/10 of the size of a human hair in diameter, so very, very small. And these gases and particles come from multiple different sources. The primary sources in modern society are the burning of fossil fuels. In our most recent research at the University of Michigan, we've looked at the way the particles can affect human health very specifically in a controlled experimental manner. So what we've done is we've created a facility that's able to take air pollutants from the everyday existing air and concentrate it into a chamber where healthy humans can be exposed, and we can monitor their cardiovascular responses to short-term 1, 2, 3 hours of inhalation of these particles.
The air quality we usually expose them to would be also found in an urban environment near a roadway. We do a variety of vascular testing, so we look at their blood vessels and then their responses before and after being exposed to air pollution.
Air pollution inhalation over a 2-hour period caused a significant increase in the diastolic blood pressure by between 4 and 6 millimeters of mercury. In people with underlying coronary artery disease or heart failure or who are susceptible, this small increase may be exaggerated and cause larger increases, as we've seen in other studies, or it may actually be able to trigger acute cardiovascular events such as heart failure and stroke. Our physiologic studies have really corroborated what the large epidemiologic findings have shown, and that is indeed short-term exposure to air pollutants can elicit responses capable of triggering cardiovascular events such as heart attacks, strokes, heart failure in susceptible or vulnerable individuals. I think there are very important practical measures that one could take to try to avoid exposure to high levels of air pollution. Most of these are very practical, feasible methods, such as trying to avoid exposure to high levels of traffic and using common sense, not exercising during rush hour times or by busy highways or freeways. And if indeed it's shown from the sources where air pollution levels are forecasted that the levels are going to be high, to potentially avoid outdoor activity if you're one that's at very high risk, such as somebody with underlying heart disease, diabetes, or lung disease.